10 minutes. Hello, class. My name is Olga Tansy. I'm here to give a speech. And the purpose of my speech today is to inform, specifically to inform you on shaken baby syndrome. Today we're going to talk about three main things about this disease. First, I'm going to take you through the causes, like what causes the disease. Second, I'm going to talk about the diagnosis, like what you see on a child to determine that they are suffering from the disease. And the last but not the least, we're going to talk about the prevention, the preventive method, ways to prevent this disease or to reduce it from happening. To begin with, I'm going to define what shaken baby syndrome is so you all will be on the same page with me. Shaken baby syndrome is a condition that results in an infant being violently shaken by the caregiver or the parent. This was coined by Health Canada in their article in 2001. Mangaka and Conway went ahead to let us know in their report of 2004 that this disease is the leading cause of death in infants under 2 years of age. It is a term used to describe an infant that is being violently shaken from the correlation of the injuries and the way the child is being injured. The main cause of the injury is the severe acceleration and deceleration that the child feels and experiences when they are being shaken. The most common acceleration and deceleration is when an adult holds an infant from their tonsils and shakes them violently. In shaken baby cases, the shaking is severe. So the shaking is so severe that the baby is forced to move forward and backward, and the baby's chin actually strikes the baby's chest and thus causing injuries in the brain and in the spine. The head travels in a rotational manner, moving the baby forward and backward. Fractures of the skull and long bones. The ribs may also be affected in the case of the shaking. The child is not only being shaken, but the child is also impacted against a hard surface. 25 years later, in 1971, Butchley, a British physician, suggested that subdural bleeding was caused by extreme whiplash, forcing the tiny bridging veins in the child that transport blood to the child's brain to cut. 1 year later, Caffey coined the term whiplash shaken baby syndrome to describe infants that were shaken but could not show any subdural external trauma. That is to say, you could see an infant, but you wouldn't tell if they are suffering from shaken baby syndrome or not, but they actually are. In 1984, Ludwig and Wallman introduced the term shaken baby syndrome in their study of infants who had been shaken but showed no external trauma. The main causes, there are many things that actually cause a baby to have shaken baby syndrome, but most parents are ignorant about it, which is exactly the reason why I chose to talk about this disease. The main cause is the severe rotation. In 1860, Theodore reported the thickening of blood in the surface of the brain of Parisian children, which was a victim of child abuse. That's to say, abusing a child physically will not only lead to wounds or physical damages on the child, but can actually cause damage in the child's brain. Also, in 1971, Gutschkelt, a neurosurgeon, reported subdural hematomas as a fracture of battered child syndrome and postulated that brain injury was caused by shaking. So this actually lets you know that most injuries of the brain of infants under the age of 2 years is caused by either the infant being violently shaken by the caregiver or the parent, or being impacted against a hard surface. He wrote that, I quote, relatively large head and pony neck muscles render the infant vulnerable to whiplash injuries. He also noted that good shaking was felt by British parents. Diagnosis. And now we're going to talk about the diagnosis. Diagnosis is actually how you can tell that a baby has been shaken or a baby has the shaken baby syndrome. Shaken baby syndrome is a difficult thing to diagnose. First, because most parents, when they go to the physician, they really do not explain to the physician the actual cause, like what happened before the child has what they have, like what happened. Like they really don't explain. They really don't know how to explain to the physician the cause of what the baby is experiencing. And since they can't explain, it is really difficult for the physician to diagnose the cause of the baby's disease. In a recent British survey, the annual incidence of inflicted subdural hemorrhage was 21.0 and 24.6% per 100,000 children under 1 year old. Most children were aged less than 6 months. This was reported by Showers in his 1992 article. So you can see that there are many children out there who are suffering from the shaken baby disease, but since most parents are ignorant about it, they really do not know what is going on, so they cannot take the child to be diagnosed of the disease because most parents think it's normal. It is difficult to diagnose the disease except if the explanation is really clear, like if the parent really explains clearly to the physician what happened to the child. To diagnose shaken baby syndrome, however, physicians look for retinal hemorrhage, that is bleeding in the retina of the eye, like when the child is bleeding in their retina, in the eye. Or the increase, or another way to know that a baby actually has the disease is if a physician can tell from an increase in the size of the child's head due to fluids and tissues in the brain, like too many fluids and tissues in the brain. That's another way that a physician can actually tell that the child has been shaken. Physicians actually use two methods to diagnose the shaken baby syndrome. They use the computed tomography, which is commonly called CT, and the magnetic resonance imaging, which most people commonly call it MRI. These are scans to assist in showing injuries in the brain. But the problem with this is it is very expensive, and of course, since it is expensive, you can tell that an average parent cannot afford this. So most parents would rather stay with their babies at home instead of taking them to the hospital when they know they cannot afford it. Since shaken baby syndrome is a very dangerous disease and it affects many children today, it is hard to diagnose, and children suffer with the injury. It is permanent. Even if it is diagnosed and treated, the injuries that the child suffers from are permanent. You cannot stop the injury. Like, the injuries are irreversible. It is an irreversible situation, meaning that if a child has the disease, it can be prevented from further having the disease, but the damages that the disease already caused remain permanent. So various ways have been suggested to help prevent the disease or to help stop the disease. Some ways have been suggested. First, it has been suggested that medical attention can help prevent the disease, of course, the impact of shaking. But children are still left with the permanent damage. To further prevent the syndrome, Dr. John Caffey, who first described shaken baby syndrome in 1972, called for massive public educational programs to actually inform the parents and the caregivers on the dangers of shaking, slapping, or impacting their baby's head against a hard surface. Furthermore, parents need to go to the hospital and make sure they get their children immunized. Children under 2 months immunized against any fluids or any damages in the brain. Parents should be educated on the causes and the damages that shaking their babies cause. I chose to talk about this because to inform you about this, because this is a disease that most parents are ignorant about, like they really don't know it. Because sometimes the parent, out of ignorance, might try to shake the child, like pat the child to put the child to sleep, or shake the child in an attempt to stop the child from crying. They actually do not know that by doing that, that they are shaking the baby's head, and the baby's fluids are being mixed and passed into the brain, which actually causes the baby to have the disease, which actually causes the baby to have the disease. So today I've informed you guys on the causes, the diagnosis, and ways to prevent it. So I hope from now on, if you're a parent, you should know the dangers of shaking, slapping, or even whipping your baby, or even abusing your baby physically. Abusing your baby physically does not only give the baby physical wound, but it also affects the baby internally, which that's what most parents don't know about. That's exactly what I want to inform you all today about. Do not physically abuse your baby. Do not shake the baby to put the baby to sleep. There are various ways that can be used to put the baby to sleep, rather than shaking the baby, or, whipping them or something like that. So we talked about the causes, the diagnosis, and the ways to prevent it or to stop it. So I will close by letting you know that shaking baby syndrome is very dangerous for the child, and most parents or caregivers should be aware of the dangers of shaking, slapping, or touching their babies or impacting their baby's head. I hope you all understand the dangers of shaking the baby, and I hope my purpose was clear, and I hope you got my purpose. Thank you.